This show is brought to you by the Chiropractic Broadcast Network. Check us out on the web at chiropracticbroadcastnetwork.com. And hello, everybody. Welcome to this edition of Tuning into Health. This is episode number 175, March 1st, 2012. I hope you're all doing well. Whew, a lot of news out there, a lot of shocking news. Well, it wasn't so shocking because I told you about it yesterday, but it looks like the media has gone frickin' hog wild with it, which, and I was just reporting it like, yeah, what else is new? But, oh, no. You know, remember those sleeping pills linked to death and cancer risk that I talked about? Well, I'm outraged by that. That's why it's on the show, right? But I tell you what, people don't really, it doesn't matter. Do you hear me when I say that stuff? Well, no. Okay, so what ends up happening is now we're seeing sleeping pill deaths may exceed 500,000 annually. Did you just hear me? 500,000 deaths annually due to sleeping pills. Yep, this is from Health Day News. Wait till we get into that. FDA warns statin use of memory loss and diabetes risk. Another one. You don't care, though. Your tax dollars are meant to prevent this type of stuff, but you don't care. How the FDA and Big Pharma mislead millions into taking antidepressants. Are med students turning to prostitution to pay tuition? Yikes. U.S. kids consuming too much sugar. Winners aggressive, losers are not. Imagine that. People can do without yearly flu vaccinations. What? That's in print media? TheCollegiateTimes.com, yeah. Reversing disease with vibrational medicine. What's that all about? Well, we got a lot of stuff to go over, and right after this. Here we are again, everybody. Thanks for tuning in. I really appreciate it. I tell you what, we're just having a little morning Joe here this morning, and you just sit back, and what I'm doing is I'm just kind of perusing the news for you, so you don't have to. So I research, thousands of news articles every week, so you don't have to. I just kind of pick out what's interesting, and you know what? I wish I could pick out more chiropractic stuff, but I can't. You know, we're kind of a boring profession because we're not looking for the cutting edge or anything like that. That was kind of really interesting. I started thinking about that. And, we do better than medications and massage and all that type for neck pain and all that type of jazz. But there's only so much where you can go with that, right? And we have a culture that's just obsessed within the chiropractic profession anyway as well, obsessed with back and neck pain, which I think is the most boring damn thing you could ever talk about. Chiropractic is more about gaining your life back and replacing that communication between your brain and body cells and having a cohesive 100% natural feedback mechanism. That's what chiropractic's about, more so. I'm going to be doing a little lay lecture here a little bit with a PowerPoint that I put together, but not today. We'll be doing that here in the next couple of weeks. But, hey, there's some weird news out there, you know, basically from Natural News, reversing disease with vibrational medicine. Now, I've seen my share of how vibration is used with tuning forks and all that type of stuff. And you know what? I think there's a value to the tuning forks. But when I see it being used in the way it's being used, I do a face palm. Sound and all that type of stuff has its definite value, but it's not integrated properly. And with my advanced neurophysiological integration, spinal tuning, for those of you who are more familiar with it, there's a little different way in which I utilize the tuning forks. And I just spent a whole weekend last weekend watching some guy traipse around tuning forks around people and letting them hear it, but their nervous system was not involved with the process as much as it could be. So it really kind of disturbed me as well. Vibrational medicine, though, I don't think it has anything to do with medicine. The future of medicine has arrived, this article says. Imagine a non-invasive, non-toxic procedure that could regenerate nerve and muscle tissue, reverse muscular regeneration, degradation, traditionally thought to be irreversible, eliminate back pain. This is not a fantasy. It's happening now with bioacoustic vocal profiling techniques and technologies. To hear how bioacoustic profiling can help you overcome health problems, join us, blah, blah, blah. naturalhealth365.com, blah, blah, blah. It gets a website. So the old methods of modern medicines are being replaced. Sherry Edwards, a pioneer in vocal profiling, breaking sound barriers of disease, and the concept likely conjures up images that would be associated with a sci-fi flick, but it has substantiated the fact that sound under research conditions has provided support and reestablishment of nerves, reversal of diagnosis, multiple sclerosis, release of back pain, stimulation, metabolism, rehabilitation, and muscle trauma. Everyone needs to learn about these protocols. So that's going to be up on the thing. Like I said, advanced neurophysiological integration is something totally different, and the main cornerstone behind the spinal tuning technique is the chiropractic adjustment. If you look at past videos that I've had, it explains it quite a bit more thoroughly than what I'm doing right now. Hey, here's an article from thecollegiatetimes.com. It says people can do without yearly flu vaccinations. Even as warmer months approach, the threat of catching flu is still there. Flu season typically lasts through May, and as February peak comes to close, which out with when it didn't even perform, encountering people with the flu is still prevalent. But even though getting the flu mid-semester seems like an awful experience, don't waste your time getting a flu shot. God. The flu, formerly known as influenza virus, somewhat common occurrence with cases seen everywhere from 5% to 20% of the population, depending on the year. It's a respiratory infection, primarily infecting the lungs, causing high fever, body aches, and other symptoms. In most cases, the symptoms can be handled with rest, plenty of fluids, certain medications to reduce the fever and pain, which that's exactly what you don't want to do, because the fever and the pain, I'm sorry, it's there for a reason. Most people completely recover from the flu after about a week. Yeah, it's about 7 days with treatment or without. With treatment, it's been known to extend to 10 to 12 days. So, here, just a second. So why get a flu vaccine at all? With any drug, there isn't a 100% success rate, but recent studies suggest that it's a 77% chance the flu will be prevented. No, I don't think so. High-risk demographics. So why are they're promoting the flu, which they have a title that says that people can do without the yearly flu vaccinations. Oh, well, that will be up on my page at facebook.com/Rohlfsen. You can look at it there. Hey, guess what? Did you know that winners are aggressive and losers are not? People are more aggressive when they are better off than others, U.S. French researchers suggest. Study co-author Brad Bushman, a professor of communications and psychiatry at Ohio State University, said winners, those who outperform others on a competitive task, act more aggressively against people they beat than losers did against the victors. Well, yeah. All three studies involved people who believed that they had won the competition. They were then directed to conduct an aggressive act against someone they perceived to have lost the competition. Now, that's just encouraging them to be poor sports. So interesting. But somebody spent money on that. Winners are aggressive, losers are not. That's the circle of life, dude. That's the survival of the fittest. Not telling anything new there. U.S. kids consuming too much sugar. Imagine that, with alcohol, tobacco, and salt locked in the crosshairs of the public enemy. Number one seems to be sugar. A new report from the CDC, the same people that would hire Bill Bibb, shows that 16% of the daily caloric intake of children and adolescents coming in added sugar in food and drinks, and recommended amounts is more than 15%, but includes fats as well as sugar. Now, I tell you what, I thought it was really interesting because when you look at the packaging and everything, you're seeing more and more and more high fructose corn syrup in everything. Not just some things, everything. And it's really shocking when you see natural sugar posted as an ingredient. And so that's what we do, is we look at the label. If we go more high fructose, get the high fructose corn syrup out of our diet. Now, you can't do it everywhere. I like a Coke. I like Coca-Cola, and I don't have it very often. I really don't. I would say less than 2-3 a month is what I have when it comes to Coke, and I really enjoy it. But I try to watch my consumption of high fructose corn syrup. We even have bread right now that it says on the package, high fructose corn syrup free. So you know things are bad when products start doing that. Here, med students turning to prostitution to pay for tuition. Increasing portions of students in the United Kingdom looking for a way to pay for their tuition are turning to prostitution, according to a new paper in the British Medical Student. The problem may be particularly among medical students who generally go to school longer, accrue more debt, and have less time for paid employment, according to the paper Jody Dixon, who is studying at the University of Brigham. So, interesting. Dixon pointed out a study about 300 British university students in which 10% reported knowing a student who had worked as a prostitute or as an escort in 2010. That's up from 6% in 2006 and 4% in 2000, Dixon said. Rise coincided with the increase of college tuition fees. Wow. How the FDA and Big Pharma mislead millions into taking dangerous antidepressants. This comes from Natural News, folks. So, let's see like this. The antidepressant fraud toothpaste. What? The antidepressant fraud toothpaste is out of the tube, at least partly. A Harvard Medical School psychologist, Irvin Kirch, has been studying the placebo effect for 3 decades. Recently came up with a documented conclusion that pharmaceuticals and antidepressants don't work. This is big news from Natural News readers and writers, but the conclusion had been prescription pad psychiatrists in the FDA crying foul loudly. Why? Kirsch's conclusions was featured in the national 60 Minutes television report. And even more importantly, Kirsch's conclusions was evidence-based on documents obtained from using the Freedom of Information Act. So these documents were trial results from drug companies that were not published and presented to the FDA. So he went outside the mainstream, looked behind the curtain, and they're all mad at him because he looked behind the curtain of what was really going on. That really makes a lot of sense. Really makes a lot of sense. If you're looking for healthcare, advanced healthcare, that you don't have to worry about your insurance, you don't have to worry about taking drugs. In fact, a type of healthcare that encourages you to get off all unnecessary medications, I want you to check out the Spinal Tuning Chiropractic Center right after this.
We love our chiropractor, and I've got 3 great reasons why. First, there are no appointments, which is great for my busy life. Second, we don't waste a lot of time sitting in a waiting room. Dr. Chad actually respects our time and schedule. Third, we get unlimited care at a low fixed monthly fee. That's right, my family's care is based on our needs, not the insurance company's ability to pay. You can love your chiropractor too, and your first adjustment at the Spinal Tuning Center is free. The Spinal Tuning Center is conveniently located on Merle Hay Road, right off Interstate 80. Find out more at spinaltuning.com or call 727-4000.
tuning into Health with Dr. Chad. Oh boy, we aren't done yet, folks. We aren't nearly done. Just got a couple more articles. When was it? When did I do the show? Tuesday. I don't know where this week is gone. It's gone somewhere that I don't know where. It went so fast. Okay. So I talked about the sleeping pills. I think it was Tuesday. And linked to death and cancer risk, according to the British Medical Journal. So you know it's got to be true, right? That's mainstream. And you know, it ticks me off because every time I do this type of show, for the past 3 years, I've always had articles telling you about mainstream drugs and their adverse events and adverse effects and all this type of stuff. And it's like you don't even see it. You don't even want to see it. You don't even acknowledge it. My God, if I found out that sleeping pills deaths may exceed 500,000 annually, and that's in a mainstream publication, Health Day News, from the British Medical Journal. It's quoting from, oh my God, what the hell are you doing? What the hell are you doing? Wake up. Wake up. Health Day News. Hypnotic sleep aid used to associate 3 to 5-fold higher mortality risk compared to non-use, even among patients taking relatively few pills a year. Study the data indicated. So patients prescribed 0.04 or 18 doses per year had a hazard ratio of 3.60 compared with the patients who did not have prescription for hypnotics. So that's what they call these things, hypnotics. Interesting. Doses. See, whenever somebody tells me about their dosage of medication, they always say it's such a low dose. It's such a low dose. And their doctor tells them, don't worry because it's such a low dose. Low dose or not, 500,000 deaths per year. So between 320,000 and 507 excess deaths associated with hypnotics were estimated to have occurred in the United States in 2010, according to researchers. From this non-randomized study, we cannot be certain of what portion of mortality associated with hypnotics may be attributed to these drugs, but the consistency of well, you tell you what, these drugs are used with a lot of other drugs. You know, the average senior takes about 8 to 12 different types of medications, and I bet this Ambien or whatever sleep aids are with them. So I also bet that these medications are also, Whitney Houston was on them as well. There's a lot of famous people that are just dying off because of medication use and whatnot. It's not illegal medications that we're using. It's their prescribed medications. So on that note, I tell you what, I just get so frustrated because I want you to hear me. I want you to understand what I'm telling you, and what I'm telling you is coming from the mainstream, but it's not being reported as such. 500,000 deaths annually from sleeping pills, and people just don't care. I tell you what, wake up, folks. It's time to wake up. Take care. Bye-bye.